van Helden, the director at Stellenbosch University's Medical Research Center, is joining me. Today we're going to be talking about zoonotic TB and why it's so important to address this strain of TB. Hello.
Good morning.
Now, tell us exactly what zoonotic TB is.
So zoonotic TB is TB very similar to human TB, and it in fact is in humans, but it is a different species of Mycobacterium. So the normal human TB is from Mycobacterium tuberculosis. This is Mycobacterium bovis, which primarily affects mammals and is then transferred to humans.
Why don't we often hear about zoonotic TB?
I think it's the routine diagnostics that are currently used don't differentiate between the two. So that's the first problem. We don't actually know how much TB in humans is from M. bovis. Secondly, most clinicians are so overwhelmed by the sheer burden of TB from Mycobacterium tuberculosis that they don't think it's important because it's a minor fraction of the burden of disease from TB.
Now, there's a health circle, if you will, when it comes to zoonotic TB. Talk us through the chain of events that happens and how this is really burdening the TB world.
Sure. So, if you think of it, the ecosystem in which we live as three major components, and that is the wildlife component, the livestock component, and the human component, then TB can travel between these three components. So quite often, in fact, it starts in livestock, moves into wildlife, and it can either then go back to livestock and from there to humans, or in any direction between those three. So in South Africa, being a classic example, Mycobacterium bovis is not a natural disease in South Africa. It was introduced by cattle imported from Europe, moved into the wildlife, and now it exists in both of those components, and it can cross into humans from either.
Now, the goal is to end TB by 2035. What do we need to address when it comes to zoonotic TB to help get us there?
Right, we need to actually address TB in wildlife, we need to address it in livestock, and we need to address it in humans. So in some perhaps more wealthy nations, TB in livestock is being addressed, but even in countries like the UK and Ireland, it's still not controlled. It's a huge problem. The UK probably spends $1 billion a year on trying to control bovine TB, and so far they have not been all that successful. And part of the problem is the relationship between the livestock and the badgers. So you can see even in a fairly simple system like the UK, we can't control it. So in a more complex system like in Africa, it's going to be more difficult. So we cannot ignore wildlife, we cannot ignore livestock, and we cannot ignore humans in this whole One Health concept, which is what veterinarians have been talking about for years.
We're at the end of the conference. What's the most positive message you've taken away from the conference this weekend?
We really are making a lot of progress in all aspects of TB. When I first started in TB a bit more than 20 years ago, we couldn't even dream of what we have now. So the diagnostics have advanced fantastically. Our knowledge is so much better than it was before. And I think that we have all sorts of new paradigms to think of. So we're thinking about things like how do we differentiate between infection and progression to disease, and then of course there's the treatment of active disease and the treatment of drug resistance, where it comes from. We have so much better understanding of all of this now. I'm actually pretty positive.
Now, I think the very fact that we're speaking about zoonotic TB is a step in the right direction, so thank you very much for sitting down with me.
It's a pleasure. Thank you.